Large pores are one of the most common aesthetic complaints, but the reality is pores can't be completely removed. In this video, I'm going to discuss about the evidence-based strategies, focusing on reducing their appearance by targeting factors that make them more visible, and these are excessive sebum, reduced elasticity, and abnormal keratinization. These are the causes of enlarged pores. Number one is excessive sebum production. The oily skin stretches the pore openings. And two, decreased skin elasticity due to aging, sun damage, collagen loss makes pores larger. And three, keratin plug formation, which is a buildup of dead cells. And four, genetics, which determine the baseline pore density and size. There are many topical agents. Top of the line is topical retinoids such as tretinoin and adapalene. These increase cell turnover, reduce keratin plug formation, and boost collagen. Another choice is topical niacinamide 2 to 5%, which reduces sebum production and improves skin barrier. Studies show significant reduction in pore size over 8 to 12 weeks. Topical azelaic acid is another choice. This is for mild comedolytic and anti-inflammatory, useful for acne-prone and rosacea-prone patients. And another is salicylic acid, which is beta-hydroxylic acid. These are lipid-soluble, which penetrates pores and dissolves debris, evidence for reduced oiliness and pore visibility. There are energy devices with evidence base. The first is fractional lasers, either non-ablative 1550 nanometers or ablative CO2 or AIAC lasers. They stimulate dermal remodeling and collagen production, which leads to improved elasticity and pore appearance. The other is microneedling with or without radiofrequency. They induce new collagen synthesis, reduction in pore size, especially with radiofrequency aesthetic devices. And there is also IPL, which helps mainly if vascular or pigment issues are contributing to visible pore contrast. Injectables such as botulinum toxin in microdosing. These are intradermal microinjections, reduce sebum production by inhibiting acetylcholine on sebaceous glands. Clinical studies have shown visible pore size reduction lasting 3 to 4 months. Supportive measures such as having regular chemical peels with glycolic salicylate or TCA, they control exfoliation, reducing keratin plugs. Sun protection with sunscreen or sunblock, it prevents loss of dermal collagen, which worsens pore visibility. And lifestyle such as reducing high glycemic load and dairy products have also been implicated in worsening of acne or oiliness. So as one can see, there are many options available, but we start simply. The first step is to use daily sun protection sunscreen and the gentle cleanser. Then we move on to topical, starting with retinoid and niacinamide, and add on with BHA or azelaic acid if oily prone. And thirdly, we can always add on a monthly peel with glycolic acid or salicylic acid. We can also add on fractional laser or microneedle RF. And finally, one can consider microdoses of botulinum toxin if persistent sebum persists. The important points to remember is that pores cannot be closed or removed, but their visibility can be reduced with a proper approach, first starting with topical retinoids, then with energy devices, and optionally one can use micro injections. The best results come from a combination therapy over several months. I would appreciate if you can comment, share, and subscribe to the channel.